Hi, I'm Swapna. Today we are here with Dr. Bharat Patodiya, who is a medical oncologist working at a tertiary hospital in Hyderabad, on topic of the most common cancer in India, which is breast cancer.
Thank you very much for the invite.
So, doctor, we are all aware about cancer, that it is on a rise in India. So, we'd like to know about it.
So yes, you are right, Ms. Sapna. Breast cancer is the most common type of cancer in India. At present, the latest data in 2018 suggests that there are 1,62,000 new breast cancer cases, and unfortunately, not only the number is increasing, the type as well as the age at which it is presenting is also changing. Now, more and more younger people are coming with breast cancers. So breast cancer unfortunately in India usually presents at an advanced stage and require treatment which can help us to control it. Treatment depends on the type of the breast cancer, and it can involve from tablets to certain injections, surgery or radiotherapy also. Now we have something known as immunotherapy for advanced breast cancers.
So, doctor, how can I know that I'm at a risk of breast cancer?
So Swapna, your risk of breast cancer depends on multiple factors. For example, age is most important. Earlier, after 50 years, breast cancer was common. Now, especially in the urban population, breast cancers are coming at a younger age. So many of my patients are in the age of group of 25, 30s. So, but as the age increases, yes, your risk factors increases. Other risk factors are if you have previous histories of breast cancer or lumps in the breast which is requiring biopsies, then there are certain genetic conditions, for example BRCA mutations. If those are present, then you are again at a higher risk of breast cancer. And then there are separate screening regimen for a BRCA positive patient.
And are there any protective factors of breast cancer?
So protective factors are not applicable to all types of breast cancer, but let's say that you are predisposed for hormone positive breast cancers in which the breast cancer is dependent on estrogen. So for those type of breast cancers, if you maintain a healthy lifestyle which includes ideal body weight and other risk factors for cancer such as sedentary lifestyle, you avoid that, then you can reduce your risk of breast cancer.
Also, my friends have been taking some hormonal contraceptives for last few months, and are they at any increased risk with that?
So yes, it's a very commonly asked questions that if I'm taking a hormonal contraceptive pills, am I at increased risk? So the association between breast cancers and hormonal contraceptive pills are not strong. So at present, we consider that the patient who are taking or people who are taking hormonal contraceptive pills are not increased. However, if there is a increased family history or you are BRCA genetic mutation positive, I will suggest you should avoid hormonal contraceptive until unless that is the only way of contraception possible.
Also, smoking. I heard that it is one of the most common causes of lung cancer. Does it also increase chances of breast cancer?
So yes, I'll say smoking can cause or increase the risk of multiple cancers, most common and most strongly associated with lung cancer, but it can cause multiple types of cancer like head and neck, esophagus, stomach, liver or kidney cancers. However, with breast cancer, the association is not so strong, but I will not say that you can go ahead and smoking if you are not at increased risk of breast cancer. You should avoid smoking at all cost.
So, say someone undergoes a physical examination and the doctor says that it could be a breast cancer. What should be the next step?
So, Swapna, the most important step in evaluation of breast lump or breast cancer, suspected case of breast cancer, is physical examination. So, in a physical examination, a trained hand like a surgeon or a oncologist can determine in most cases that it looks suspicious for breast cancer. So, any type of cancer, two things are most important. The first is the staging. The cancer is localized to one place or it is already spread elsewhere. And the second thing, most common or most important in the treatment, is typing. What type of this cancer is. Same applies for the breast cancer also. So this staging is done by the PET CT scan, usually by PET CT scan. in which we find out if the disease is present anywhere else in the body than the breast itself. And the second thing is biopsy. Biopsy is a bedside procedure in which a small tissue is removed, thick needle. It is usually uncomplicated, no major chances of bleeding. There is a misconception among a lot of people that biopsy can increase or flare up the tumor, but that is just a misconception. So biopsy will be the next step, and the second step will be the staging, which usually we do by a PET CT scan of the whole body.
So, doctor, let's say biopsy is also done, which confirms it to be breast cancer, but someone could not make head and tail of the report.
Okay, Swapna. So you want to say that what are the important aspects of the biopsy?
Yes.
It's a good question. The interpretation of biopsy is more for medical people, but the three things which you can see on report, which are of the imminent and most important aspects, is what is the hormone status. So you can see ER/PR report. If it is positive, then treatment is different, and if it is negative, then treatment is different. Then the third thing which is most important is HER2 status. So if it is positive, then you have to give certain injections which are known as monoclonal antibodies. Along with that, with chemotherapy, it also makes a cancer relatively more fastly dividing if HER2 is positive. Few labs also give another test known as Ki-67, which if it is high than 14%, then it is considered to be a kind of aggressive tumor. But yes, I will say leave that details to your oncologist to interpret it.
Okay. So, say PET-CT scan suggests that there is a focal area in the bones along with breast lump. What does that imply?
Okay, so this is a common situation. As I mentioned, PET-CT is now routinely used to stage a disease. So stage 1 and stage 2 is something which is localized only to the breast. Stage 3 is something in which the nearby area to the breast, for example this armpit, is involved. So there are certain organs known as lymph nodes. The lymph nodes becomes positive. Stage 4 is something whenever a disease starts at one place and goes to another system of the body. For example, a disease starts from stomach and has spread to the liver. So it started from one organ, went to the second organ. So it becomes a stage 4. Similarly, bone is also considered a organ. So of a disease, let's say the breast cancer for today, breast cancer has started, and on a PET CT we find it to be present in some part of the bone elsewhere. It means it becomes a stage 4 disease. The intention of treatment in stage 4 is control of the disease. We cannot start a treatment with the intention of cure, but we can control it with appropriate treatment. That is the importance of a PET CT and the bone lesion which you are talking about.
So, doctor, I read a lot about breast cancer on internet and found out that there is something known as triple negative breast cancer. What does it mean, and how to know that someone has triple negative breast cancer?
Yeah. So Swapna, in continuation with our previous question in which we discussed regarding interpretation of the biopsy report, those same hormone markers which I told, ER, PR and HER2, if all three of these are negative, that is known as triple negative breast cancer. The implication of being a triple negative breast cancer is the tablets which can be offered in a ER positive breast cancers will not work on this, and the only option at present which we can give to a patient is chemotherapy. Also, after surgery, chemotherapy plays important role. If the disease is already metastatic, present in a stage 4 disease, then probably we can add immunotherapy along with chemotherapy, but chemotherapy remains the backbone of the treatment. We cannot offer tablets or hormonal therapy in this situation. That is the importance of triple negative. Moreover, triple negative is considered to be a aggressive type of breast cancer, so chances of control or coming back is higher.
Also, I would like to know what exactly is chemotherapy. When a patient undergoes a chemotherapy, what happens?
Yes, so it's an important question. Many people are confused, or they misinterpret the data available from various sources. People think chemotherapy is something very dangerous, painful, or something horrific. But chemotherapy is something just a saline. So we dilute certain injections which can kill cancer cells in saline bottles, and we give through IV injections. So it is usually not painful if given appropriately. So that is chemotherapy. Then there are certain injections known as immunotherapy, that is also given by injection diluted in saline. So the other modalities of treatment is radiation, in which certain focused energy is casted on certain part of the body as per requirement. So radiation is done by a radiation oncologist, while chemotherapy is done by a medical oncologist like myself. I hope it clears.
Yes. Also, I'd like to know, suppose a patient doesn't want to undergo chemotherapy. I have heard about immunotherapy that a patient can take.
Yeah. So immunotherapy is boon of science to today's cancer patient. So till recently we did not have anything to offer once chemotherapy is exhausted. Now immunotherapy is something which we can offer after exhaustion of chemotherapy if certain tests are positive. We can also give immunotherapy to patients who are not so fit or they are frail. So what does immunotherapy implies is, one of the mechanism how a cancer cells survive in our body is that it cheats the immune cells which can kill the tumor cells. So one of the mechanism is, let's say there is an expression of certain chemicals known as PD-L1. If these tests are positive, so these are tumor cells mechanism, that is how it is making immune cell stop working on the cancer cell. By giving these immunotherapy agents, we can remove this checkpoint between the immune cells and the tumor cells, and the immunity start working on killing of the tumor cells. For this reason, since there is no direct effect on cancer cells or normal cell, the side effect profile is much different. Majority of patients are able to tolerate immunotherapy very easily.
And just for discussion, if someone is destined to receive chemotherapy, what are the side effects we can expect?
Okay, so there are certain side effects which are cosmetic. For example, hair loss, darkening of skin, or darkening of the nails. These side effects are usually reversible. Once the treatment is over, they reverses back to normal. Then few side effects are present in the labs. So certain labs, if we do, for example, your hemoglobin may drop, your platelet may drop, your immune WBC levels can drop. They directly do not affect you, but by their dropping, you can develop certain infections. Then there are some rare side effects, like some chemotherapy can cause effect on heart pumping action. Usually the percentage of patients developing these side effects are less than 10%. So if a chemotherapy is very toxic, then it does not come in market. But if in the market, it means majority of patients are able to tolerate it. Nowadays we also have certain injection with which we can stop or we can control the amount your immunity falls to. So we call it filgrastim or colony stimulating factor, so WBC do not fall later. So that has also helped us to control it.
So, is there any implication of being diagnosed with cancer while being pregnant? And how will the treatment plan differ from a non-pregnant woman?
Good question. It itself is a big topic. So cancer in pregnancy. But let's say a breast cancer is diagnosed early in the pregnancy. The problem is, during the pregnancy we cannot do many of the tests. For example, no CT scan can be done, radiation cannot be done. So we cannot do certain surgical procedures, for example known as breast conservation surgery, in which only limited amount of breast is removed. We cannot do that in early phase of pregnancy because radiation is a compulsory part. So we have to remove breast completely in case a breast cancer is diagnosed while on the pregnancy. If a breast cancer case is diagnosed late in the pregnancy, then we can initiate the chemotherapy. The usual chemotherapy which we give do not cross placenta, the covering of the baby. So we can give the treatment. Of course, there is a risk of higher bleeding during the pregnancy, and once the baby is delivered, we can go ahead with the radiation surgical part as usual.
Does breast cancer happen in males too?
Yes, it's a very common misconception that breast cancer do not develop in male patient. However, you will be surprised to know that 1% of breast cancer is found in males. The treatment is considered more or less similar as a aged woman. So we do the biopsy, we do the staging PET CT scan, and then we operate it, mostly removal of the breast lump and addressal to the certain part of armpit, followed by chemotherapy and some hormonal therapy if indicated.
What can I tell my friends and family members when to seek medical help regarding breast cancer?
It's an excellent question from a general person view, because people don't know when to seek help from a medical person. People usually neglect changes in their breast, delay till it becomes painful or it involves the skin. The key of successful cancer treatment is early detection. So if a lady sees asymmetry in the breast or a sudden onset or a recent onset lump in the breast, then they should take a medical advice. If they find discharge, especially bloody discharge, and especially if only one side of the breast, then they should seek medical help. If there is a redness, skin is involved, skin is dimpled, wrinkled, especially on the one side of the breast, then you should take medical help on this topic.
Also, I heard about Angelina Jolie. She got her breast removed by operation for prevention of cancer. Is this surgery the only way to prevent breast cancer?
So good question. In today's urban population, there is awareness about genetic condition in the breast cancer, that is BRCA mutation. So Angelina Jolie tested positive for this test. Yes, the most effective way of prevention in a patient of a BRCA mutation is removing the breast totally. However, it may not be conducive at all ages and all type of population. So there are certain tablets which we can offer to the patient in case they are BRCA mutation positive. The other implication of a BRCA mutation positive patient is, for a normal patient who is not BRCA positive, we offer mammogram as a screening tool. But if somebody is BRCA positive, then MRI becomes the choice of investigation for such patient for screening.
So there is a lot of information available on Google, but then nothing is certain. Is there a website where I can get genuine detail and brief?
Yes, thank you for asking that question, because today we live in between information explosion. If you search any topic, especially a topic like cancer, the information is infinite. It doesn't end, and many of website or many of blogs rather confuses the patient. And for this same reason, I have founded this website known as nocancers.in, that is KNOW, cancers.in, in which I have focused more on treatment aspects of cancer. So rather than focusing on theoretical discussions about cancers and their prevention, I have focused, once a cancer is diagnosed, then what is the proper steps, what patients can expect, and what treatment can be offered in that point of time. So that is my efforts to public awareness from cancer treatment point of view.
This was a very good interview. We got to learn a lot of things. So thanks a lot for this, and I look forward to visiting this website soon.
Thank you very much for the invite. Feel free to give me a call, and thank you to Ms. Sapna for interviewing me today on breast cancer.